Well, good afternoon, everyone. My name is Blaine Eccles. I'm the Dean of Students and the Vice Provost for Student Affairs. And I am absolutely thrilled and excited to be here with you this afternoon talking about vaccines for the coronavirus. I cannot think of a more exciting time over the last year than what we're talking about today, which is truthfully bringing the end of a very long year to a close. We're starting to see the beginning of the end, it feels like, and starting to open up. I do want to welcome everyone on behalf of President Green and Provost Lawrence to the University of Idaho Vaccine Town Hall. We appreciate everyone being here today, and we definitely appreciate all of the questions that have been posed to us ahead of time. And we are hopeful that this event will be able to answer many of the questions and address some of the myths out there in regards to the vaccine. And so we want to help create information to help you make an informed decision on what you need to do and how you can impact your experience and those of others in many positive ways by getting the vaccine. It's been a long year, as I said, and since the coronavirus came into our communities, and it is an exciting time to have the vaccine available to many of us. I know I personally got my first vaccine shot the other day, and I'm thrilled about that. We have great panelists here representing a wide variety of areas that we'll get to in just a moment. And we also have received many great questions, as I said ahead of time, that we will be answering. But we also have an opportunity for you to pose some questions while the session is going live. You can do so in a couple of different ways. First, pose a question in our Q&A box on the Zoom webinar, or if you are joining us via Facebook, please leave a question in the comments section. We have several individuals working behind the scenes who are not on the screen here with us at the moment that are monitoring for those questions, and they'll be posing those. And we're going to do our best to get to as many of those questions as possible so that we can address the questions you have, but we may not get to all of them. But I want to assure you, we are absolutely gathering those questions, and we will be putting those into a Q&A that we will be posting on our uidaho.edu COVID vaccine webpage so we can get information out to you. This session is being recorded, and it will also be posted to that website. So if we talk about or say something and you missed it, don't panic, don't worry, we've got your back. You'll be able to come back and check it out, and it'll be posted within the next 24 to 48 hours so that you can check back in on it. For our Zoom today, we will have some brief presentations from all of our panelists, and then we will jump into the questions that we have. So I'd like to start off our time today with our first panelist presentation, and that will be with Mike Larson for Public Health. So Mike, I'd love to turn it over to you for a moment. So please take it away.
All right, thank you, Blaine. My name is Mike Larson. I'm one of the nurses from Public Health Idaho North Central District, or our local public health here in District 2. And my position down here is the clinical supervisor for basically immunizations, disease investigations. So it's this group of people that have performed all of the investigations. I'm sure many of the people listening to this have received calls from the nurses at Public Health and probably been annoyed at times. And they're also the same nurses that are providing vaccine down here. And so that's our primary part right now with the number of cases that have decreased. We're finding ourselves very active in the vaccination aspect of this. And so one of the things that had been put to me as a point to make was, why is it important for people to get vaccinated? And I think the most important reason for vaccinations is to make sure that we can have as many people in the population immune to COVID-19. And the benefit to that, of course, is the herd immunity that everybody's talked about, you've heard about. It is the way that we get as many people immune to the virus as possible, either through vaccination or through the short-term natural immunity. And then when you have that many people immune, then the people who can't get the vaccination or are not going to be immune are going to be they're going to be insulated from other people in the environment that may be infectious. So that's the most important reason. It's going to protect you, it's going to protect the community, and it's going to protect those people who aren't going to be able to get the vaccine for whatever reason. And the whole purpose of all of this is we all want to get back to whatever normal is going to be post COVID-19. That's the whole push here. We want to get back to where, as close to where we can as we can. So there's other issues. There was one question that was posed about why the CDC is making some of the recommendations. There was the issue of can you still get COVID-19 after you've been vaccinated? And from a vaccine point of view, all of the vaccines for COVID are very effective. But any type of vaccine, you can have people who don't develop immunity. So it's always possible that you're not going to get immunity from any type of vaccine, including COVID vaccine. However, for those people who do get the vaccine, complete the series, whatever that's going to be, either the 2 shots or the 1 shot, depending, for those people, it is still possible that they can be tested positive for the virus. And so that can take 2 different appearances. Number one, they're actually symptomatic. Those are called breakthrough cases. And nationally and in the state, there are a few of those that we are seeing. The other type of person is going to be somebody who is going to be asymptomatic but positive for the virus. And we're not quite sure what that means in regards to whether or not they can pass that virus on to other people. And so that takes us to a third point, which is, what do you do after you're vaccinated? Do you get to just go back to normal? And the recommendation from the CDC is to continue observing the things that we're doing right now. We want people to continue wearing face coverings. We want people to continue isolating, or not isolating, but social distancing as much as possible, and to avoid large groups. Now, why? Because we don't know if people are able to if people are able to carry that virus. We're not quite sure how infectious they are. So therefore, we want to, until we learn more about how all of this is working, we want people to be as careful as possible to not spread the virus. And then one of the last points that I was going to make, Blaine, was some of the folks have had lots of questions about whether or not people from other parts of the state, other parts of the country, the students here at the University of Idaho or other parts of the world, if they can get the vaccine here in Idaho. And indeed, yes, you can. If you're a student at the University of Idaho, then definitely we welcome anybody here, even if you are a permanent resident in another state, another country, whatever, you can get your vaccine here. We do ask you, however, to use your local address, because that helps us to verify that you are part of the University of Idaho. So I think that pretty much sums up my questions, unless you have other, Blaine, that I didn't touch on.
Mike, thank you so very much. And I just want to say on behalf of the University of Idaho, thank you, Carol Morrill, as well as all the other great folks that work at Idaho Public Health, the North Central District. You've been phenomenal partners with us over this last year and really helpful to us. So thank you so very much for that. And thank you for that presentation. And we'll come back to you here with a few questions. I now want to turn our presentation time over to Dr. John Brown from Gritman Medical Center. I'll be absolutely honest, Gritman Medical Center has also been an outstanding partner to the University of Idaho and the Moscow community. And I just want to say thank you so very much on behalf of the University of Idaho for all the things that Gritman Medical Center has done to support our institutional efforts, support our community, and support our students. So John, I would love to turn it over to you for your presentation. And I know you have a few slides for us to be looking at as well.
All right, thank you, Blaine. Yeah, for those of you who are new to our area, Gritman Medical Center is a community critical access hospital that serves Latah County, and it's downtown Moscow. I'm sure you see it if you drive down Main Street. I've been a physician in Moscow since 1998, working primarily in family medicine and emergency medicine. So I've had lots of frontline experience caring for students in this community. I've also been the chief medical officer at Gritman Hospital for the last several years. And so I've been involved in coordinating our response to the COVID-19 pandemic and to immunizing both our staff and the community and the university. So I want to talk a little bit about vaccination. Why get vaccinated against COVID-19? You've already heard some very good reasons. I'd like to just kind of run through them again with a few numbers. Vaccination does decrease new infections and reinfection. As you can see there, all the authorized COVID-19 vaccines have demonstrated efficacy ranging anywhere from 65 to 95% on preventing new infections with COVID-19. Vaccination also greatly decreases the risk of hospitalization and death. So even if you manage to be one of those people who gets fully vaccinated and catches COVID afterwards, either as a second infection or as a new infection, you're very unlikely to end up in the hospital or critically ill or die if you've been vaccinated. And then the odds are greatly improved for you by vaccination. Also, it's been recently demonstrated that vaccination greatly decreases asymptomatic cases. So that's people who get sick but don't get the fever and the cough and other things, but they can still spread it to other people. The vaccination greatly decreases that from happening, and so you can help prevent covert spread through the community. Also, vaccination appears, as best we can tell in this early stage, to provide a superior immunity to COVID-19 than natural infection with fewer complications and dangers. You always have to weigh the dangers and complications of a disease with those potentially caused by a vaccine. And it's pretty clear that COVID, despite the fact that most people do really well with it, has some very serious potential downstream consequences: cardiomyopathy, prolonged neural injury, all sorts of things that we don't really know exactly how they're all going to play out. We do have the example in the past of polio, way before everybody's time, way before my time. Large numbers of people caught it, and then decades later, the post-polio syndrome showed up, where the damage they had suffered as young people through the natural attrition of time was starting to show up again in their 50s and 60s and 70s. My own mother suffers from post-polio syndrome from a case that she contracted in her teens. So we just don't know, and it's best to just avoid those kind of unknowns. There does not appear to be significant consequences to the COVID vaccine. We do know that there are some consequences with COVID infection. Next slide, please. So vaccination combined with the other measures, like was said just recently, is very effective at helping to stop the pandemic. And it's our best chance of getting back to a relatively normal life as soon as possible. Without vaccination, the timeline for the pandemic is likely to stretch out significantly longer. Next slide. So there are two classes of vaccines currently available in the United States. The Pfizer and Moderna vaccines, which are the ones that are available in our community right now, are messenger RNA-based vaccines. Basically, clever people made messenger RNA, which is the genetic code for a particular protein, and encapsulated it in a lipid layer that is taken up by cells. The apparatus within our cells uses that messenger RNA to manufacture a spike protein, the S protein, which is then shown to the immune system, and a specific immune response is generated. Appears to be a very effective mechanism and a very safe mechanism. There were some vaccines prior to this that used this technology, one of the Ebola vaccines, and they had a vaccine for one of the other SARS epidemics that was also made on this technology. So it's not a completely new technology, though it's never been used on such a wide scale, but it does seem to be very effective and very safe. The second is viral vector vaccines, and that's what the Johnson & Johnson single-dose Jansen vaccine is. Basically, they took an adenovirus and they rearranged its genes so that besides the usual genes that it would have, it would express the ability to make the S protein. No other components of the COVID virus are contained within that genetic material. And so you're not getting infected with COVID, you're just making your cells manufacture the spike protein using the vector of an adenovirus to get it into your cells. And so it doesn't make you sick with an adenovirus. It doesn't give you COVID virus. It's just a way of getting that genetic information into the cell to manufacture that spike protein. This technology has also been around for a while, and the Sputnik 5 vaccine, which was brought out in August of last year by the Russians, is exactly this sort of vaccine. And the Russian experience with it has been very favorable, with over 95% efficacy reported by the Russians. you know, being an American, I always have to be a little bit skeptical of things they tell us out of Russia, but the data does seem to be holding firm that that they are having a really good experience with that vaccine, and the Jansen vaccine is very similar to that. So I would expect us to have a similar outcome. Next slide. So why are there different dosing regimens between all these vaccines? I mentioned Janssen was a single dose, Pfizer's 2 doses, 21 days apart, Moderna's 2 doses, 28 days apart. Why can't they just all be the same? Well, the answer is they're all a little bit different. And the goal is to get a maximal immunity with the shortest interval and number of shots. So each of these vaccines is going to have a different dose response curve. In other words, you give a dose, you get a certain level of antibody that is produced, and you give a second dose, you get more antibody, and maybe even a third dose, you give even more antibody. And so the question is, when is that enough? And for the Pfizer and Moderna, they found that these dosing intervals in 2 doses optimally gave you a good antibody response, whereas with the Janssen, a single dose gave you a sufficient dose of antibody load, and the second and further doses didn't significantly increase that in a way that was clinically relevant, so there isn't any reason to give a second dose. Which one of these is better? I personally am a little bit favorable of the Pfizer just because the data, we have the most data on it, and it seems to be very efficacious, but they all seem to be very good vaccines. The only way to really tell which ones are better is if we do head-to-head trials on them, and you know, we are kind of doing that now by giving the different vaccines to wide numbers of people. But until we really get that data back, we won't be able to answer the question of which one is the superior vaccine. So I would feel, if you are offered any of these, I would feel comfortable that they all will work effectively for you. Next slide. So all the side effects among these 3 vaccine types are pretty similar, and we've administered thousands of vaccines at Gritman, and we are comfortable that the data that's being reported nationally and internationally is actually what you see, a very minimal side effects. Most vaccines, including these vaccines, will produce some local side effects a day or 2 after you're injected, when your immune system starts to say, hey, there's something here to react to. Those are pain, redness, swelling, lymph node enlargement near the site of where you got the shots. If you got in your left arm, it's going to be lymph nodes in your left armpit. And then some people will get systemic side effects. Fatigue is the most common, headache, muscle pains, chills, fever, nausea. There's a few very rare side effects. There's been a handful of cases of Bell's palsy, which is a swelling of one of the facial nerves that gives you a little nerve dysfunction. But we're talking like several cases out of hundreds of thousands of people. So, you know, very rare sorts of things. There are the problem of immediate allergic reactions. If you are allergic to any of the components of these vaccines, you can have an allergic reaction. Allergic reactions are things like hives, swelling, wheezing, respiratory distress, anaphylactic shock, you know, things that can be bad. And so we always will have you hang around for a little while after the vaccination for 15 minutes if you're an otherwise healthy person, 30 minutes if we have reasons to be concerned, and to see if that's going to happen, because anaphylactic reactions happen quickly if they're going to happen at all. If you're not sure, consult your doctor on whether or not you should get this particular vaccine from an allergic reaction standpoint. The incidence of allergic reaction does not appear to be any different than any of our other vaccines. Any concerning reactions that you have should be reported to your doctor. If they appear to be serious, like you're feeling like you can't breathe or you're lightheaded or any of that kind of stuff, then call 911 and seek emergent care. When in doubt, get it checked out. We want to know if people are having reactions. We put it in the data bank, and it helps us to understand how these vaccines are working. Next slide. Okay, that's it. Are there any other questions at this time that anyone would like to ask me? And there will be certainly time at the end.
Yeah, John, what we're going to do is we're going to hold off on, we've been getting several questions that have come in for both you and Mike. We're going to hold the questions here until everyone kind of goes through their presentations, but then we will definitely come back. So I have a couple that will be coming your way. And just as a reminder for all of those that are watching here today, we will be posting the slides that were up on this presentation as well on our website, our uidaho.edu/COVID vaccine website. So that will be coming as well too. So Dr. Brown, thank you so very much. Really good information, really informative and educational too. And I appreciate that a great deal. It brought back some of the remembrance of my chemistry classes, quite frankly, from when I was an undergrad. So I'd like to turn now to Anna Fulmer, also with Gritman Medical Center. So Anna, if you are there, Anna is one of our lead individuals that is running the vaccine clinic down at the Student Recreation Center. So Anna, I'd love to turn.
Yeah, so my name is Anna and I work for Gritman Medical Center. I'm a nurse here at Gritman, and I also am the Director of Risk and Compliance currently, and like Blaine said, the clinical lead of the vaccine clinic. So I just wanted to talk a little bit about what you can expect when you come to get a vaccine and how to sign up. So when you come to, first we'll talk about signing up. So if you want to sign up for the vaccine, there is the Idaho Prep Mod that you can go to, and you can search for locations there. If you are looking for a Gritman specific location, then you can go to our website, gritman.org. There's a COVID resources link in the top, and you can go to that. That will take you to get a vaccine clinic appointment. Once you get to that, it will automatically filter the Idaho Prep Mod for you and take you directly to the clinics that we have open. We do currently have clinics open. We're trying to keep the clinics open 2 weeks out so that you can plan accordingly. Also, in our description on those clinics, there is the dates of when you'll get your second dose so that you can plan for your second dose when you sign up for your first dose, so that you don't have any questions on when your second dose will be. We'll also be helping to remind you of that when you come through for your first dose, so that that's very clear. As far as what to expect when you come, so you'll sign up for a time. We would prefer that people keep on their scheduled time. It just helps so that we don't get a bottleneck when you come to the SRC for the vaccine. And so you'll come in, you'll be checked in by a couple of greeters. They'll give you a consent and some literature on the vaccine that you're receiving. Once you get those and get the consent filled out, then you'll be moved forward to the registration area where they'll need your ID and your insurance card, and they'll get you all registered. They'll give you your vaccination card at that point, which you'll take with you through the rest of the clinic. You'll see our pharmacist who will ask about allergies. She's the one that filters if you need to wait that 15 minutes or the 30 minutes. And then once the pharmacist has talked with you, she'll go ahead and put the vaccine into the system so that it's in your record. And then we'll direct you to one of the nurses that we have giving vaccine. They'll give you the vaccine, and then in the center of the gym, you'll sit where we have a monitor who's usually an RN there to watch for any reactions. If you're having any kind of trouble breathing or any of, there's like Dr. Brown talked about, any of those side effects that can start immediately, then we'll try to help with what we can there. And we have stuff on hand. If you do have a reaction, we're prepared to help with that. So if you're concerned about that, we are prepared there to deal with that. As far as after the days after the vaccine, like Dr. Brown said, you have the immune response, so you might have some flu-like symptoms. We'll give you a sheet on that, and on that sheet there will be some tips, but just a couple of things is that it suggests that you don't pre-medicate with Tylenol or ibuprofen for the vaccine, because it causes it not to be as effective. And then after the vaccine, you'll want to drink lots of water, make sure that you'll have time to rest, and you'll want to make sure that you just monitor your symptoms and can treat those. And I think that's, and then time for coming to get the vaccine, you'll probably want to plan between a half hour to 45 minutes, depending on if there's a line or not. If there's not a line, you'll get through in about 20, but you should plan at least a half hour to get your vaccine.
Great, Anna. Thank you so very much. I'll just say from personal experience real quick before we go on to our next panelist. I went and received my first dose of vaccine on Thursday of last week. It was a phenomenal experience down at the SRC. The Gritman staff did a fantastic job of supporting everyone, answering all the questions. It was a really smooth process, just really beneficial. So thank you, and thank the rest of your team for a great experience. And I'll give you a little pro tip for those who haven't received the vaccine yet. Figure out which side you like to sleep on at night. And I personally got the shot in the arm that I don't sleep on because it was a little sore afterwards and whatnot. So that's just a little tip ahead of time for when you go to get your vaccine. Just as a reminder for folks, you can submit questions in the Q&A function on the Zoom bar or in the chat in the Facebook session. We are getting those, and we're getting a list of questions we'll be getting to here shortly. And this recording will be made available later on our uidaho.edu/COVID vaccine webpage, likely in the next 24 to 48 hours. Anna, thank you again. We'll come back to you here with a couple questions that I know are coming in. We're now going to go to our next panelist, Brandy Terwilliger, our Executive Director of Human Resources. And we asked Brandy to join us today because we know some employees are going to be here and having questions about the vaccine. To are they required to get it, and or do they submit information to it? So I asked Brandy to just kind of step in and help us address some of those employment related questions. So Brandy, I'll turn it over to you.
Thanks, Blaine. Yeah, so I'm Brandy Terwilliger, Director of HR, and we've had a few questions come in. And although all vandals are encouraged to get the vaccine, it's not a requirement, and you're not required to provide us with a copy of that vaccine information, and you don't have to disclose that information to anyone. A few of the other questions that keep getting asked are if you can use any of your sick leave or annual leave to take the time to get the vaccine. And yes, you can. It is the appropriate use of sick leave. And just as a reminder, there's also the medical appointment leave that the university offers at 2 hours a month. And so that would be another good use of that leave if you have that available and haven't used it yet. Another question that is often asked is if you have effects, if you're not feeling well afterwards, are you able to use sick leave following that? Again, if you're not feeling well, that is the appropriate use of sick leave. And of course, if you want, you can use annual leave or other accumulated leave, but those are all appropriate uses of sick leave as well. So certainly do so if you feel you need to, and just make sure that you're using the proper call-in procedures and don't just not show up. So that's always a good reminder. One of the other questions is if folks have had a work adjustment related to COVID-19, whether that be a flex work arrangement or other work adjustments. We are working through that process, and we'll be proactively reaching out to employees that have a discretionary flex work or a medical related request due to COVID. So we'll reach out to you proactively when the time comes and see if you have an interest in extending your arrangement. And a lot of folks have already indicated that they don't plan to, but you'll have the opportunity to provide that information at the time. And if you wish to continue it, we'll let you know whether or not additional documentation will be required based on medical or non-medical. As always, if you have any questions, please let us know from the employment aspect of it, and we're happy to assist.
Great, Brandy. Thank you so much. You and your department have been just incredibly helpful to a lot of our employees over the last year, and just really appreciate the Herculean task you've taken on helping accommodate and support many of our employees here at the university through the last year. So thank you so very much. We do have a couple questions that I think I'll circle back around with you here in a moment, but I'd like to bring up our final panelist, which is Lauren Carlson, our student body president, our student extraordinaire. And I asked Lauren to be part of this panel just from the perspective so we have a student voice on it, but also talking about her lived experience as it pertains to vaccines. So Lauren, I would love to turn it over to you to just share your experience about the vaccine and your thoughts on why students should get a vaccine.
Thank you, Dean Eccles. Again, my name is Lauren Carlson. I'm the ACUI Student Body President. I'm so happy to be here. I'm really happy I was able to get the vaccine, and I'm really excited that it's available to everyone 16 plus in Latah County now. I was able to do so actually a week before it opened up in the state through Walmart's like waste reduction program. This was available to people who called to get on a list when someone did not show up for an appointment, or there was going to be some reason they couldn't get the vaccine that day. People on this list were able to be called even if they were not within the specific stage, just so that that vaccine didn't go to waste in that day. And I took advantage of that opportunity because I think it's so important to get this vaccine. I am in my senior year at the university, and this year has been unlike any other. And so I'm really excited to hopefully we can make some changes here and some movement, have a bit of a normal year next year for everyone who's going to be continuing their education, and getting a vaccine is a part of that from my perspective. So I was really happy to get that done, and I'm going to get my second one in less than a month. So I'm very excited, and I just think it's something that everyone should obviously do their research into, be well informed, but also use this opportunity within Latah County to get the shot, especially if you're going home to somewhere where it's not an opportunity. It is available, and we still have over a month and a half left of school, so you have the time to do the month-long period if you end up in that specific vaccine. So really excited to provide any other student feedback. And I want to say, if you are getting your vaccine, you're not the only one. I know so many students who are getting it too, so keep that in mind too if you have any questions.
Lauren, I'm going to do just a brief follow-up question for you. As far as your first shot, how did that affect you physically afterwards? And did you have any negative effects or anything that you'd like to educate folks about?
I know that negative effects definitely can happen to people. I was one of the lucky ones who didn't have a ton of them. I had a bit of a stiff arm, so the recommendation to get it on the one you don't sleep on is a great one, because I actually did get it on the one I slept on, so that I think made it a little bit worse, but it was nothing that stopped me from like going to school or anything like that. But I do know some of my friends have had some like night sweats and some chills and things like that, some nausea, which is normal, and it's something just to be aware of, and I think that's important that we're being like transparent about that with the vaccine. So luckily I was one of the few who didn't have a ton of reaction, so hopefully that stays true with the second one.
Great, thank you, Lauren. And just for clarity's sake for our students, if you do get the COVID-19 vaccine, that's great. You do not have to provide verification to the university that you received the vaccine. You can keep that information. If you do get the vaccine and have questions about what you should do if you get asked to participate in surveillance testing for the coronavirus moving forward, please feel free to email COVID-19 vaccines at uidaho.edu, COVID-19 at uidaho. COVID-19 questions, I'm getting everything all screwed up. COVID-19 questions at uidaho.edu with questions, but you do not have to submit proof of vaccine. I would like to ask our panelists all to turn on the cameras now, because we've been getting quite a few questions coming in, and so I'm just gonna kind of go around the room and start with a multitude of different questions in regards to what they look like. And I'll start with you, Dr. Brown, or you, Mike, for the following question. How are the three vaccines, and Dr. Brown, you kind of touched on this, how are the three vaccines different from each other? And is one better than others in any way?
Yes, it's a good question that I don't think anyone has the complete answer to. I think what we do know is that they all appear to be efficacious at preventing serious illness and at preventing new infections. No doubt they do vary from each other in terms of some side effects and in terms of the absolute numbers, the percentages of cases prevented and hospitalizations. And I think you'll just have to kind of stay tuned to see which one. I mentioned that I have a slight preference for the Pfizer, but that I don't have a really firm foundation with which to announce that. I think a lot of people have been looking for the Jansen vaccine to be a good answer because it's a single shot and you can get a lot of people done. In Britain, they've experimented with using just single shot vaccination, and they've now achieved over 50% of their population demonstrating protective immune globulins. And so that would indicate that perhaps that might be the better way to go. That's all I think at this point we can say.
Great. Mike, do you have anything else you'd like to add to that?
The only thing that I would add, the recommendation from the CDC is to find out whatever type of vaccine is offered to you and to go with that vaccine, because the most important thing is to be vaccinated.
Great, thank you. I've talked to several students, and one of the questions posed kind of touches on how quickly a lot of these vaccines were developed and they were supported, which is great, and the CDC approved, but they haven't got standard trials for recognition for what that looks like. Is there any concern about this being still considered experimental vaccines, as opposed to these are vaccines that we can trust in, and just try to help educate folks? Because I think there's some hesitancy out there in regards to vaccines because of how quickly they were developed. And so Dr. Brown or Mike, perhaps you might have a thought on that too.
Yeah, if I could start out with that. I think it would be useful for anyone who really wants to dig into that to go to the FDA site and look at the actual emergency use applications that these various drug companies submitted. And it will give you the nitty-gritty details of how many people were tested, you know, the 30,000 for Moderna, the 40,000 for Pfizer and whatnot, how they were broken down, their demographics, what the outcomes were. And you can see that they followed these people out for 4 to 6 months. And we have a pretty good idea of, in that time period anyway, how these vaccines behave and how well they work. And so that's pretty good information. Now, obviously, it's not as good information as if we had a 10 years experience with that, but there's just no way we can build a time machine and make that happen. You have to kind of deal with the world that we live in. And we do know what COVID does to people, and we have a pretty good idea what the vaccine does to people. And it seems fairly clear to most unbiased observers that the vaccine is the way to go for taking care of this. I'd like to address briefly just one of the questions that is on the that relates to this about students being enrolled in a vaccine trial. I think that the person who asked that question is mistaken as to exactly what a vaccine trial is. A trial, you select certain people, you exclude lots of people who have had prior infection and other conditions, and then you randomize them either to receive the vaccine or to receive a placebo. None of that is happening at the University of Idaho. There is no selection for placebo. There is no excluding of people because of prior medical conditions and other things like that. Anyone who wants it can get it. And so this is clearly not a vaccine trial. Now, to give them their due, we are watching very closely the outcomes, the side effects, the consequences, and that's just medical prudence. It's not a vaccine trial. And so that, I think, is the more accurate way to look at it.
Great, Dr. Brown, thank you. Mike, anything else you'd care to add to that?
No, I think that sums it up nicely, very nicely.
Great. We have an exciting question, actually, but a really important one to some individuals. But is it safe to get a vaccine if someone is trying to conceive? Does the vaccine impact the ability for a woman or a man to get pregnant? Obviously, for the woman to get pregnant. We have an individual who's expressed concern that they'd really like to get the vaccine, but they're nervous that it could impede their ability to get the vaccine. And so I honestly don't know who's the best person to answer that question. I would assume you, Dr. Brown, might be the best person to address that question, but open that up to anybody.
Yeah, I'll start with it anyway. This certainly was a question I looked at quite a bit. Back when the Pfizer was making its emergency application in November of last year, one of the Pfizer former VPs submitted a letter to the FDA requesting that the vaccine not be granted a license. And he had a long laundry list of reasons, most of which were kind of baloney, but one of them was concern about fertility. And so in reading that letter that he wrote, I talked to multiple providers, including Dr. Manudri and Dr. Trin and Dr. Campbell, who are 3 obstetricians here in town and in Pullman as well, and did a lot of research on the topic. And it turns out that there's really no good theoretical reasons to suspect that there's any interference in fertility with these vaccines, with these S proteins, antibodies against these S proteins. And so even from a theoretical standpoint, there does not appear to be a significant risk to conception, maintaining a pregnancy, or delivery. On the other hand, we do know that pregnant women who contract COVID are at a significantly higher risk for serious illness, organ damage, and death. And so it's definitely a better playing of the odds, it appears this time, to get vaccinated. And the vaccines appear to be safe in pregnancy. At the moment, we don't have extremely great data. What we do know is, for example, in the Pfizer vaccine, in the course of them testing it on 40,000 people, 23 of them got pregnant during the trial, about equally distributed between the placebo limb and the vaccine limb. And of those 23, there was only one pregnancy complication, and it was in the placebo limb. So it was in someone who didn't even get the vaccine. All the women who were vaccinated had normal pregnancies. So there doesn't appear, those are very small numbers, but it doesn't appear that there's a problem. And there doesn't appear to be a theoretical reason to suspect there will be a problem. So that's a relatively safe conclusion, and most obstetric groups are recommending vaccination with any of these vaccines. The Russian example, it may be the best for us. Again, you have to, I'm not sure exactly how much I'm willing to trust their data, but they've vaccinated millions of people in their population using an adenovirus vector vaccine, and they've observed no pregnancy complications, if they can be believed. So I think that you have to, like everything in life, play the balances. We know that COVID can be bad in pregnancy, and there's no clear evidence now that the vaccine is bad in pregnancy. I really wish I could give you a complete, absolute 20 years experience of this vaccine and assurance that there isn't any problems, but that data does not exist. And so I think your best playing of the odds, though, is to go with what we do know, which is that COVID is bad in pregnancy. The vaccine appears to be safe in pregnancy.
Great. Dr. Brown, thank you very much. I would also probably just add on to there, talk to your doctor very intentfully about that too. You know, if that is something, seek out guidance from your family doctor as well in regards to what that looks like. Anna, I actually have a question for you. Should an individual who signs up for the vaccine show up at the SRC at your exact scheduled time, or should they get there a little early to combat the time spent waiting in line?
So if we're trying to get people to show up at their scheduled time, if people show up at their scheduled time, we have the numbers calculated that you'll get through. But if a whole bunch of, like, usually, especially in the morning, like when we first start, we usually have a huge rush of people that show up, sometimes up to 50, and then that gets us behind for the day because we're trying to get through 50 people right at the beginning. If people stayed with their 10, we have them spaced 10 minutes apart with 12 people for every 10 minutes, and we can get those people through if people stay with their vaccine time. If there's something that, like, something comes up and you still want your shot and you're signed up that day and you absolutely can't come at that time, then just come that day at a different time that the clinic is at. As long as you're on the list and signed up, we'll let you through. So
great, thank you. And just kind of as a follow-up, Lauren, I'm kind of curious, what was your time frame for getting a vaccine since you were on the no waste list and you were reached out to otherwise? What did that time frame look like for you from?
So mine looked a little bit different because I had to fill out some forms first with Walmart, and I did have to sit. They only had one person doing the vaccines, and there was a couple of us who had been called that day, so we all showed up at the same time and kind of bottlenecked ourselves. So I did take about 45 minutes to get mine, including my 15-minute like waiting period afterwards to make sure I was okay, which I was. So it took about 45 minutes total.
Great. So I would be remiss as a dean of students if I didn't make a plug for bringing books to study for our students. When you go to get your vaccine, they have chairs. You can sit, you can read, you can study. You can even surf the internet because it is in the SRC. We have opportunities, but always use that opportunity to study. It's never a bad idea to bring a textbook with you and get ahead on what that looks like. We do have a question in regards to an individual. I just lost my question. The person posed the question, I'm getting my vaccine tomorrow, I'm getting vaccinated tomorrow, and I just started taking SSRI. Should I be concerned about an interaction? I will be absolutely honest in saying I have no idea what SSRI is. Clearly that individual knows, and I'm hoping, Dr. Brown, you know what SSRI may be, but is there any concern about the getting vaccinated tomorrow on SSRI?
Yeah, those are selective serotonin drugs that are antidepressants for the most part. An example would be like Zoloft or something like that. Paxil. There's no known interaction with that class of drugs. People who take them do sometimes have increased flushing and lightheadedness and a few other things. And so if you're just starting one of those drugs and then you get the vaccine at the same time and you get the side effects of the drug and the side effects of the vaccine, it may be hard to sort out what is what, but there's not going to necessarily be an additive or interactive effect. It'll just be confusing and irritating. And you may want to consider not having them both happen at the same moment, but that's something between you and your doctor. And I appreciate you bringing that element in. That is very important. There's no generic advice that fits a particular individual. You have to get that individual advice.
Great. Thank you, Dr. Brown. I appreciate it. Anna.
So one thing that I can add to that too is that when you come to the SRC and you see the pharmacist, they're going to ask the one thing that is really critical when you're getting the vaccine is that she'll ask if you've had anaphylaxis, which means throat swelling to any injectable medication like an antibiotic or another vaccine. And that is something that makes it more risky to get the vaccine. It doesn't mean that you can't get it. It means that we're going to watch you closer. You'll probably stay for that 30-minute wait time after you get the vaccine. So just to be prepared for that, if you have had anaphylaxis in the past, that will be an additional wait time.
Great. Thank you for that added information. That's really helpful to know. There's a question that is posed, and Mike, you might have a response to this, and Dr. Brown, you as well, as it pertains to the CDC releasing new information that there could be benefits to mixing the doses, i.e. you get a Pfizer shot once and then you follow it up with the Moderna or something like that. And so it's really a question of, is that advisable? One, is that a bad thing? Two, and three, are we doing that here in Moscow? And so I'm not sure who best might be able to respond to that, either you, Dr. Brown, or you, Mike, or you, Anna. Who would like to start with that response?
I guess I can start. I actually read that question and went out to the CDC site to see if I could find more information. And I haven't been able to find the reference that was referred to. And so basically what I'm going to go off of is the previous information that we've had from the CDC, which is it's best to get the same type of vaccine. If you start with Pfizer, you need to end up getting your second dose of Pfizer. If you start with Moderna, you need to get the second dose of Moderna. The CDC does go on to say that if somehow there is an accidental switch, you don't negate the series, you don't get a third shot, you don't do anything like that, you would be considered fully vaccinated, but it is still the recommendation to get the second dose of the same type of vaccine that you received on the first.
Great. Anna or Dr. Brown, do you have any other comments to add to that?
Yeah, I would agree completely. It's at the moment, the CDC recommendation is to use the same vaccine. There are some theoretical reasons to maybe mix them, you know, because if you stimulate the immune system with this in this particular way with one vaccine, and then you stimulate it against the same antigen in a different way, you might get a more pronounced antibody reaction. So there's a theoretical reason for potentially mixing them, but we don't have the data for that, and we like to keep with the devils that we know rather than devils we don't know.
So when we did a little research on it and among my team, and that it's exactly what Mike said. If you do get one and then the other by accident, it's not harmful and you still get the immunity, but it's recommended to get the same vaccine that you got the first time. So we are not mixing them. We won't give somebody a Pfizer on their second dose if they've had a Moderna. We'll follow that up with a Moderna is how we're running our clinics.
Great, thank you. I have a follow-up question as it pertains to, as we get towards the end of the semester, and we're still 6 weeks out, 7 weeks out, but some students may not get the vaccine until a few weeks out from the end of the semester, and they're not able to get the time frame in place to get their follow-up shot. Is there a problem with getting a partial dose now and then down the road? Like, what would you advise students if they receive only a partial dose here and then they return home to Southern Idaho or California and they're not able to come back here and get into the standard cycle of the 3-week or the 4-week window? What does that look like for follow-up for students that way?
So I can speak to that a little bit just because we've had some experiences with that where like somebody lived in Boise, got theirs, and then came up here and asked for their second dose. The problem with that is that they're allocating so much doses to different public health districts, which Mike can probably speak to a little more. But so essentially, if you got your first dose here, then we have your second dose, and you know, St. Luke's in Boise doesn't have it. And so unless somebody doesn't show up for their second dose down there, then they may not have the dose. So that's just a risk that that you could take, I guess, so to speak. But also there have been people who have gotten, the CDC came out with guidance that said, you don't have to get it at the 21 days or the 28 days. It's recommended that you do, but if you're longer out than that, it's not a detrimental thing. So.
Okay. Anyone else care to address that?
I guess I would just throw in the one more comment. I totally agree. Just as a way that is done is the first doses are sent, and then at the appropriate amount of time, that's when the state then is moving the second doses for exactly the same people. And so if you received a first dose in one place, there will be a second dose for you there, and it just becomes more of a logistical nightmare for trying to make all of those connections work without the wastage of vaccine. Remember that all of these vaccines are in multi-dose vials, and we really like to end our clinics with all of the doses from that vial being utilized and not having any type of waste.
Great, thank you, Mike. I see one question that I'll answer, and it's whether or not the University of Idaho is going to be requiring the vaccines for students or employees. And the short answer is no, we will not be requiring that this spring nor next fall. Some institutions have moved in that direction. The University of Idaho is not moving in that direction, and we are not looking to require that question or that vaccine. So Anna, I have another question for you. Does an individual bring prescription labels to the vaccine clinic in the SRC so that the pharmacist can review what someone is taking medication-wise as it pertains to connecting with the COVID vaccine?
No, they don't need to do that. The biggest thing that we need to know is what they've had reactions to. There's not really any literature on contraindications with any medications except for if they've had an anaphylactic reaction to something. So that's going to be the biggest piece of information that we'll need in regards to medication.
Great, thank you. This is kind of a unique question, but I think it's really an important one. It says the Idaho Pre-Mod website requires me to provide insurance information. I do not have health insurance, but as a veteran, I have health care with the VA. Is there specific information that should be provided from the VA for someone to get the COVID vaccine? And if not, will an individual be charged for the administration of the vaccine? And if so, how much will that be? Mike, I don't know if you can address that, or Anna, you might be able to address that from an insurance question.
I can if Mike has. So as far as the insurance information on PrepMod, we have, you can choose to have them enter that or not. On our PrepMod link, we have turned that off. We are getting people's insurance information as they come through the registration. If they don't have insurance, it doesn't mean that they cannot get it. Still come, there are grants and stuff to cover those costs. If they don't have insurance, we're only charging for the administration fee, which the Medicare is the one who decides how much we can charge for that. And so it's $40 per dose. So it's not a huge amount of money, but there is some grants and stuff out there to help with that. So don't let insurance discourage you from getting the vaccine. Getting the vaccine is the most important part.
Great, Mike, anything else to add to that?
The only thing that I would add is I would agree with everything. The intent from the federal government, this is vaccine that was purchased by the federal government. There you can charge for the administration, just like Anna said, but the intent was that there would not be a rejection of anyone to receive this vaccine that could not pay for the administration fee. So it should be quote unquote free to everybody. So there should be options to find that for everyone.
Thank you.
And Blaine, sorry, and most insurances that I've heard are covering that administration fee at 100%. I haven't heard a lot of complaints about insurances not covering that. So just so people know that that is has been being covered pretty good by insurances.
So we do have students at the University of Idaho that are under the age of 18. And their parents aren't here. We have some 17-year-olds and whatnot. Is parental consent required for students under 18 to get the vaccine? And if so, how would such consent be given from a parent who's not necessarily living in Moscow? What would that look like?
So I can speak to that as well, sorry. So in the state of Idaho, as long as if they're going to college and they're able to understand what they're consenting for, they can consent for themselves.
Okay, so a 16-year-old, if we happen to have a 16-year-old enrolled, which I usually know if we have anyone that young, but we've had them that young before, they would also still be eligible to get the vaccine, so long as we're within the governor's 16 and older standing. Okay.
Correct.
Next question, and it's similar to the SSRI one, I think, but it's a question that says, can I take the HPV vaccine and COVID-19 vaccine together? And is there any interaction? I have my last HPV shot at the end of the month, at the end of next month. And so it's a person who's worried about the mixing of the vaccines from that aspect of it. Dr. Brown, perhaps you might have a thought as it pertains to that?
Yeah, I believe, and Mike can correct me if I don't have the number exactly right, that the recommendation is that you not have another vaccine within 2 weeks of the COVID vaccine.
That's absolutely correct. They want to cushion or buffer 14 days between either a vaccine before your COVID or after.
Okay, great.
And that is not necessarily because there'll be an interaction. It's because when you produce a profound immune reaction, like in a vaccine, one of the things you do is secrete cytokines and other things that can suppress other immune response. So they're mildly immune suppressants. You may not get a good result from the second vaccine that you get.
Wonderful. This will be our last question for our panelists, and we'll wrap up. And first of all, it's a question of the governor's orders right now are making it available in our health district for 16 and older. What about individuals that are younger than 16 as it pertains to vaccines? And what should they do what should parents do to help protect them while they're waiting to get the vaccine? And is it advisable for someone under the age of 16 to get the vaccine if it becomes available to them? So I'll start with you, Dr. Brown, or you, Mike, potentially weighing in on that.
Well, you know, they just have not done extensive testing on pediatric populations, so we'll have to just wait before it's available to those folks. However, the precautions that we've recommended all along would still apply to those people. You know, observe social distancing, avoid huddling in groups and tight together in indoor spaces for prolonged periods of time. You know, if you're sick, stay home, wash your hands, that sort of thing. You know, if you're able to, wear a mask. As more and more the population becomes vaccinated, that will help protect those people. There's also, you know, appears that the pediatric population is not quite as vulnerable as the adult population. And so that's somewhat of a comfort. But eventually we will have some pediatric indications. I was just reading today in a non-medical source that someone at Pfizer is claiming high efficacy in the pediatric population for their vaccine, and they're going to apply for an emergency release for that indication, but I don't know how reliable that information is.
And I agree. That's exactly my understanding as well. Knowing that there are studies with the different vaccine manufacturers right now. Pfizer is the only vaccine that right now has emergency use authorization down to 16. But I expect that that is going to change very soon for Moderna and for the Johnson & Johnson or Jansen vaccine. And as that occurs, like Dr. Brown said, the studies will continue, and I'm sure that they will come out with recommendations for children younger than that. And then at that point, that would be a good discussion with your personal provider to decide what would be best for those people at that time. Until then, exactly what Dr. Brown said, you want to try and keep people as healthy as possible. And what parents could do otherwise is make sure that they're vaccinated in order to kind of give that cocooning effect for the people who cannot receive the vaccine as of yet.
Well, I want to say, take a moment to say thank you all so much. This kind of brings our time together as a close, but I always like to give our panelists a closing comment opportunity. And so we'll start with Lauren, and then we'll work our way backwards from how we began. So Lauren, any final closing comments you'd care to share with our participants today?
I just want to say thank you to everyone on here. I know a lot of you are a lot more involved with this than I am, and I'm really happy we have the opportunity to extend the vaccines to students and student-age people. So if you are interested and willing, please go get a vaccine. I highly recommend it, and I'm looking forward to hopefully coming back to the university next year with a bit more of a normal year ahead of us.
Great. Thank you, Lauren. Brandy, anything you'd care to share?
The only thing I'd like to add is the university health plan for employees does cover the full cost of the vaccine. So that includes the administration fee, just making sure people are aware of that.
Yeah, and I will add to that, the student health insurance plan does as well for students. It's basically, if you're an employee or a student at the university, you can show up, you will not be charged for that. And to Anna's point, they make it affordable and at no charge across the board. No one's going to be turned away from getting the vaccine. That's the important piece. Anna, any final closing comments you'd care to make?
I did want to just make one more statement. I've heard some concern that people are concerned that the vaccine is not being stored properly. And we, Gritman is really taking super precautions, I guess, and making sure that we are storing it correctly, that when we're opening the bottle, that it's only that dose is only good for that 6 hours, and making sure that we're keeping track of that time and stuff. So when you come to the SRC to get it, don't let that be a concern. We are really making sure that we're maintaining those guidelines.
Great, thank you, Anna. Dr. Brown, any final comments from you?
Yeah, just a couple. First, I would like to tell people that I think that for society as a whole, getting vaccinated is clearly the right thing to do for your community. For you as an individual, I think for most people, it's the best playing of the odds. I know that some of you are young and healthy, and the chances of you having a permanent problem from getting a COVID infection is low, but it's not zero. And I still think your best playing of the odds is to get vaccinated for you as an individual. If you have any doubts, talk to your doctor. Second is there were some questions, technical questions about the spike protein and other things, and I'd like to recommend a site. It's idsociety.org. If you dig into that, you'll find a whole bunch of information from COVID-19, and it digs deep into the nitty-gritty of these various vaccines, the molecular chemistry of it, and all that sort of thing. And you can probably find the answers to your questions there.
And to that point, and thank you, Dr. Brown, for that, there were several questions that were posed that we did not have time to get to today. We will make sure to put all of those questions in the Q&A and follow up with answers and response. And the website you just provided, we'll make sure is listed there too. So thank you for that, Dr. Brown. Mike, any final closing comments from you?
The only thing is I appreciate being able to be a part of this. I'm really, truly excited that the University of Idaho is going to be able to provide this opportunity for the students, especially before the semester ends. And I hope that everybody takes advantage of it. If it doesn't work for the students to take advantage of this, please find another avenue in any of the pharmacies, clinics, or health districts in the state, wherever you're going home to, because I really think that this is the only way that we're going to try and get back to the normalcy that we're all wanting, and put COVID-19 in our rearview mirror, and hopefully only talk about it when we're old and wanting to impress our grandkids on how difficult it was.
Thank you, Mike. And I'll be absolutely honest. The University of Idaho is strongly encouraging individuals to receive the vaccine if they are able to do that. We encourage you to talk to your doctor about that if you have concerns, and do some follow-up that way. But we have all just experienced a year of challenges, and we want to be back to our standard campus experience, just like everybody else. And this is one surefire way that we can do it. So we strongly encourage that. I want to say, take a moment once again to thank our partners with Idaho Public Health. I want to thank Gritman Medical Center. They've been phenomenal partners. I definitely want to thank our panelists here, Dr. Brown, Mike Larson, Lauren, Carlson, Brandy Terwilliger, Anna Fulmer. You all were fantastic. Really appreciate your time today. Really appreciate you taking a moment to answer questions and share your experiences and help address some of the questions. I also want to thank our team behind the scenes, Emily Tushoff, Max Stillwell, and Joanna Espinoza, and Annie Exline, who helped with the questions and facilitation of this. It was fantastic. Lastly, please visit us at uidaho.edu/COVID vaccine. We have a list of Q&As out there. We will be posting this video out there, as well as adding the questions from our Q&A that we were not able to get to today, in addition to all the ones that we did get to. So thank you all so very much. Stay safe, stay strong, stay vaccinated, and as always, go Vandals.